Hi, and welcome to the webinar. We're going to get started in just a minute. We're just waiting for folks to log in, and then we'll get started. All right, we're going to give folks one more minute to log in, and then we're going to get started. Hi, I want to welcome everybody to the Sustaining Futures, a trauma-informed, resiliency-based community practice for community colleges teaching in prison. We're going to just call it Sustaining Futures from here on out. My name is Dr. Andy Kleek, and I am the Chief Program Officer at the McSilver Institute for Poverty Policy and Research, and we're really excited to be working with the Opportunity Institute on this project. Just a little bit about what we're going to do here on this webinar today. We're really excited to kick off the Sustaining Futures project. So we're going to take a little bit and just introduce ourselves and frame the project. We're going to give a very brief overview on trauma, resilience, and trauma-informed care, just to kind of lay the foundation for the project and also give some context to why this is important and why we're taking the approach that we're going to do. And then our hope is to spend the bulk of the webinar really walking through exactly logistically what this practice, the community of practice would look like, as a very brief application, to walk through the timeline. There's an organizational decision guide designed to help everybody really identify the areas they want to focus on, and also the anticipated outcomes. So we really want to take the primary focus of the webinar is just to walk through all that and explain that to folks, answer questions and those kinds of things. We'll take some questions at the end. I will highlight for folks that they can feel free to ask questions at any time during the training. And that we will be looking at those questions. We'll probably answer the questions primarily at the end. And you can chat those questions in through the chat box, which is going to be on the right of your screen. And so you can put those questions in the chat box, and then we'll answer those questions in the end. The way we've set up the web-based training for today is actually that you can't talk, because what happens when you have a lot of people on webinars, most of us know, is that you end up having a lot of background noise, and we spend our time asking people to mute their phones. So you can chat in your questions, and we'll answer those at the end when we get there. Okay, oops, went backwards. There we go. So just a very brief overview of the McSilver Institute for Poverty Policy and Research at NYU. We're focused we live in the Silver School of Social Work at NYU, and we really focus on issues of identifying the root causes and consequences of poverty with a real lens on race and structural racism, and other forms of oppression. And we also have a very, very broad-based portfolio that works in healthcare reform, and particularly in the area of trauma, and have done lots of work both locally and nationally on the issue of trauma and trauma-informed care as well. Going the wrong way. There we go. So just very, very briefly about myself, I'm McSilver's Chief Program Officer. I oversee all our technical assistance efforts here. We work with every mental health, substance use, and child welfare agency in the state of New York on issues of healthcare reform and improving clinical practice. And I am a psychologist by training. And I'm going to let Dr. Kirk James take a second and introduce himself.
Yeah, peace. Welcome, everyone. My name is Dr. Kirk James. I'm a clinical professor at NYU. My work focuses really on trauma and the intersection of mass incarceration, people who have been impacted by the justice system, and just looking at ways in which we can create greater trauma awareness, as well as to create modalities towards healing and resilience.
Dr. Salerno?
Hi, this is Tony Salerno, and really my emphasis is on implementation, is how do you make just good ideas really happen in the real world. So that's, I'm also a psychologist and been working in public mental health systems for many years, and really looking forward to working with all of you.
Fantastic. Okay. Kelly?
Hi, everyone. So over the past couple of years, we've just heard a lot of you sort of reach out and talk to us about issues around burnout, around staff and faculty turnover, or even prospective turnover. And then some of just the sort of feeling-based challenges of teaching and learning in the prison environment. And I think a lot of you know that one of our main goals for this entire initiative is sustainability. And so we really took to heart the issue that some resources are needed in terms of addressing some of those concerns. And so we've been partnering with the McSilver Institute to offer this community of practice. So thank you all for joining us.
Thanks so much, Kelly. And at this point, I'm going to turn it over to Dr. Salerno to kind of put some framing around the project.
Yeah, I mean, essentially, we want to be able to answer some questions that you may have and give you enough information so that you can make an informed decision of whether joining a project like this is really going to work for you. And so we certainly need to share with you, so why? What's behind all of this? As Kelly had mentioned, this is in response to issues that folks have been raising, and we hope to be able to really align this effort with what the felt need out there. And so, why? What is this thing? Why it's going to be important for the work that you do. And so when we look at this in terms of why the project, so let's think about just the students right now and see if this really aligns with what your experience is. So one notion is that engaging and providing these educational opportunities, it's really challenging, right? And so there are struggles, there are barriers, there's various challenges that you're encountering. So we just need to kind of recognize that. Also, the observation that individuals in prison are really much more likely to have experienced numerous and serious adverse life events, we might call traumatic life events, and that really matters. And you'll hear a little bit more about that from Dr. James. There's also a very high prevalence of mental health issues, post-traumatic stress, sort of like symptoms and difficulties in prison populations. And here's like really a key point, and you probably know this as well as anyone, that these serious adverse life events, which really does raise the risk that folks are going to be incarcerated, it also raises the risk for a myriad of difficulties that is likely to really impact education and learning. So the issues around self-control and emotional regulation is very, very serious in terms of the impact of adversity and trauma on those basic kinds of functions. Also basic learning functions around attention and memory, verbal expressiveness, information processing, all the things that all of you know are important ingredients in being able to help individuals be successful in their studies. It also can impact healthy attachment and social relationships, which is just as important part of education as the actual instruction and learning, and just basic academic performance. All those issues that I know for all of you that you're concerned about. Now we're going to have Dr. James talk a little bit about, so what do you guys mean by trauma? And we give a very, very brief description of some of this. Okay? Dr. James?
Thank you, sir. So when we speak about trauma, right, it's really a physical or psychological experience that overwhelms an individual's ability to manage or cope. So what does that mean? Let's put that into English, right? So our understanding of trauma really historically comes from war. We saw that people were impacted when they came back. This initial understanding would become, PTSD, post-traumatic stress disorder. And today, we have a greater understanding of like the causes, right? Initially, we thought it was maybe the loud artillery going off. Today, we know that actually experiences contribute to trauma. So there's this great study that we'll look at next. It's called ACEs. And this study, which is considered oftentimes the study that no one knows about, ACEs stands for Adverse Childhood Experience. And what it did was it looked at certain variables that were coming up over and over with people who later on in their lives experienced immense trauma. And they found that there was a direct relationship between their early experiences of trauma and their later experiences. So, for instance, they found that people who had adverse experiences such as physical abuse, sexual abuse, emotional abuse, they were at greater risk for adverse childhood experiences, right? Such as disrupted neurodevelopment, such as my colleague just pointed out, social, emotional, and cognitive impairment. Also, they were at greater risk for behaviors considered risky, so the behaviors that essentially considered criminal, they were greater risk for committing those behaviors. We also saw that they were at greater risk for disease, disability, social problems, as well as early death. So people who experience a lot of these issues are more than likely the people that you work with. And if they are experiencing these issues, right, these ACEs, these childhood experiences, we know that they're going to impact the ability to show up and the ability to have the outcomes that you're looking for.
Fantastic. Thank you, Kurt. All right, Tony.
So I just want to kind of get back to, so we talked a little bit about understanding this area of trauma and trauma-informed care from the student's perspective. But now let's take a look at the faculty, and the staff. And so why this project? So the environment that you're working in really presents you with, and you know this better than anyone, the unique challenges to both you and the students. And these challenges that are faced by the faculty and staff, can really adversely affect the experience and increase your risk, really, of feeling either emotionally exhausted, having a sense of really accomplishing anything. Sometimes you just get worn out in terms of your own compassion and patience for students. Sometimes it results in detachment or loss of professional boundaries. So these are some of the negative consequences that some folks may experience. So oftentimes, faculty and staff may seek some guidance on a number of needs, right? What's interesting about this is I've worked in incarcerated settings that are called psychiatric hospitals. And I've come to learn that some of the experiences that you encounter when you're trying to, treat individuals, and also we had educational programs as well, is that incarcerated centers tend to kind of create certain kinds of challenges that are really unlike anything else. And so for you, and certainly was true for staff working in incarcerated settings, wanting a little bit of guidance. So here's some ideas, right? We're going to ask you whether or not this aligns with your felt need. So having a better understanding of how adverse life events, can affect the student's behavior. So that's one need you may have. You also may have a need to better respond. How do I better respond to students whose social and academic behavior is really affected, by trauma? How to best mitigate the adverse influence of the environment itself. We certainly heard a lot of this from some of the faculty that we spoke to, and in visiting a male and a female prison a number of months ago, we knew that was also an area that folks were concerned about. And then the other piece is how to recognize the signs that the work is negatively impacting you, your emotional well-being, your professional satisfaction, your physical health. When you're under conditions where you have persistent stress and challenges, it's not inconsequential. It can affect a person's sense of well-being and professional satisfaction. So we have basically a question we want to ask you, right? And you can choose all that really apply. So we took a guess and this is more than a guess, this is an informed guess based on what we've already heard and what others faculty have been sharing, with folks in California, and choose all that apply in terms of what interests you. So A would be understanding the role that diversity plays in the experience of your students, determining the best responses to your students, reducing the adverse influence of the prison environment as much as you can, recognizing when you are being negatively impacted in the work, and also developing strategies so that you could reduce the negative consequences of working in a prison. So those are 5 big areas, and we may not have hit everything, right? But we'd like you to select which ones would you say are really interest to you. It could be none, it could be one, or it could be all of these things or a number of these things. So please just spend a little time thinking about which ones you would check off. And you can check that off in the box, and then we'll be able to tabulate the information.
All right, fantastic. So it looks like of the folks who were able to participate, we kind of talked over the time limit a little bit. So it took, we didn't get everybody's feedback in here. But just based on what we have, I want to just kind of highlight that the 2 that got the most feedback were reducing the adverse influence of the prison environment on learning. Right. And that's very, very consistent with what we've heard. And then the other piece is that we're developing strategies to reduce the negative consequences of working in a prison.
Great. Terrific. Thank you so much for that. And it seems that there's interest across the board in these areas, which is also very, very good.
And the one area I would also highlight, too, because it was close, was determining the best responses to students whose social and academic behavior is affected by trauma. Right. So to figure out exactly what you do when you're confronted with these issues.
As we go along, if there's an area that you don't think we've captured with those 5, please use the chat box to just type that in. Say, look, those areas seem pretty good, but maybe we've missed something that really is of high concern that you have. And please feel free to put that in the chat box. Now, I want to get a little bit more deeply into some of these negative consequences, right, associated with work, and really, in many ways, with vulnerable populations, right? And this could be, we find this in healthcare, we find this in human services, we find this in education, and we certainly find this in forensic settings, as well. And so you've heard this term burnout, really. And burnout really comes down to if you just feel emotionally worn out, right? Or you're really questioning, what's the meaning of all of this, right? Or you have what's called depersonalization, which sometimes really means that I'm beginning to lose my kind of like interest and concern for those that I'm serving. So there's really overlap with some of these with each other, but sometimes the burnout can be related to workload demands, poor organizational practices that people just complain about, right, that just distracts with energy, intense time pressures, unsupportive relationships with supervisors and coworkers, and a lack of control across work environments. So burnout can be experienced really with a lot of organizational factors. Compassion fatigue tends to be specific to when you're working directly with vulnerable populations, where you're just kind of like you're getting kind of worn out, and there's a loss of empathy. You begin to be less patient. Sometimes an increase in client blaming. I certainly saw this in psych programs in psychiatric hospitals, where the patients, they came to us because they had difficulties, and it was those very difficulties that seemed like, gee, this would really be a great job if the clients were not mentally ill. And that was like that can happen. And it's just a human response that we have to understand that as well. Then there's vicarious trauma. That tends to be focused on when you are frequently listening to a person's traumatic life experiences and direct observation of people's suffering, right? And it can kind of elicit strong traumatic kind of associations for us, right? And it can take its toll when you're in a position where you're really listening to and observing the suffering of other people working in intense medical situations, burn units, and then working with individuals who've had significant trauma, which is really the population that you're working with. So what are some of the consequences? So what can happen, right? If folks are experiencing burnout, if they're experiencing compassion fatigue, if they experience vicarious trauma. So why is that important? Well, it can sometimes just lead to less than optimal teaching effectiveness, right? The instructional quality can suffer. There's less energy, right, that one has. And energy is like sort of important in terms of motivation of students. You can respond in a way that's really not that helpful to students or actually trigger some negative responding of students. So that has to do with just the quality and effectiveness of the work. There also folks can get just fed up, right, and say, look, I'm looking for another job. Just the issue of turnover, which in my field, in mental health, let me tell you, is a serious problem. People can drop out, failure to succeed. These are the students. And the program can get the reputation like this is not a place where you want to learn and work. So there's some real organizational consequences when this is not addressed. I just want to make a brief point that trauma is not the whole story, because individuals, you, staff, students, often demonstrate impressive capacity, right, to just be able to deal with these adversity and continue moving forward, continue working hard, continue being motivated to assist students or whoever it is that you're working with, really even in the face of adversity, even within the context of a prison environment, which is not the most nurturing or facilitating for the work that you do. And that really reflects this other dimension, which is called resilience. And I think what we want to really address is so much of the work these days has been around trauma, focusing on adversity, but we want to bring in the other side of the coin. And that has to do with the resilience piece and what we've learned about how you can actually strengthen resilience. And that's going to be another focus of our work as well with you. So in terms of resilience, the response to tough situations, people really vary significantly. Some people just react, overwhelming flood of negative feelings of fear and dread and loss. Some people might be triggered by very common sorts of challenges. They respond so unusually strong to situations that really aren't that challenging. But some people may be more confident, react more calmly, bounce back from some of these situations, problem solve effectively, keep things in perspective, maintain some professional boundaries. And that helps individuals to maintain high performance and high motivation. So, just to give you a sort of a visual, we're going to talk a lot about the idea of the lens that you use and the way that you see the people that you're working with. You can see them from a trauma perspective, but you can also see them from a resiliency. So we use a bifocal lens approach so that you can see you're both sensitive to, aware of both the adversity in the students, some of the adversity and experiences in yourself, but also the strength that's in students and the strength that's within yourself. And that's a trauma resilience bifocal lens. And that'll be the kind of guiding philosophy and approach that we will be taking throughout this project.
Thanks so much, Tony. So just before I dive into the content, so obviously one of the things that we could have done on this webinar is actually talked about trauma for hours. And really got into a lot of depth. But we really want to spend a good chunk of the webinar really laying out exactly what this project's going to look like. So I think once we start the project, we will be obviously doing a lot more work on an in-depth training around trauma-informed care and really building up the skills and capacity of each of the participating colleges in order to address issues around trauma, but also issues around resilience and building up faculty and staff as well. So I just want to say that this was like the world's briefest overview of trauma and trauma-informed care. Okay, so what is a community of practice? So one of the things, anytime you want to set up a project like this that's going to cut across multiple institutions, is how do you set up a system to doing that? And our group here at McSilver has been doing this kind of work for a long time, and we've found some things that have been pretty helpful in pulling this together. And one of the things that we use in this project-based approach is a community of practice. So I'm going to take a couple minutes and just walk through exactly what that is, and then dive into some of the specifics around this project as well. So first of all, we pulled together a network of faculty and staff who have a commonly felt need. So the goal is to provide a group of colleges who all have a similar need to address the issues of trauma, informed care, and resilience in the work that they're doing inside the prison context. And then that group is going to partner with us I always hesitate to say we're a panel of experts, but we have some knowledge about these issues. And our job is really to provide the clinical, technical, and social supports that are going to be needed associated with this. And the focus here is going to be on providing practical and sustainable improvements. Our approach on these kinds of things is not to change the entire world immediately, because what we found is anytime somebody sets out to do that all right at once, it just gets overwhelmed by events. So our goal is to help each college, and it'll be different for each college, to identify some practical steps that they can implement over the course of our time together and figure out a way to implement those steps in a way that will be sustainable, that'll have a marked, impactful part of their program. And then the hope is also that while we bring some expertise to the table, that each one of you actually brings a much deeper understanding of your experience teaching in the prison context than any of us. And that our experience with these projects is what ends up happening is, as it should, that the colleges learn from one another as much or more than they're ever going to learn from us. And I think, so the idea is that it's, one, helpful that we can provide some basic foundational knowledge and a structure, but ultimately each of the colleges are going to learn from their own colleagues. And I think that's really critically important to understand. So the next piece of this is we're also going to work within the context of a continuous quality improvement using CQI methods to really help people use data to inform their decision making. And Tony's going to talk about the organizational decision guide in a little bit to really walk through a structured process by which each one of your colleges can identify a plan to work in this project in a way that will have impactful change that's particularly focused on your college's needs, because each college has a particular context they work in. They may even have different contexts if they're working in more than one prison setting. And so it's going to be a little bit different for each of those contexts. And so we don't believe in the kind of one-size-fits-all approach to this. So we want to make sure that we address that as well. Okay. So why is this important? One, all of the people who are going to do this have to be committed to improving the services that they're going to do around a particular area, right? They're going to communicate regularly, both internally within your teams, and we're going to provide lots of opportunities for you guys to communicate otherwise outside of your teams with one another. And then we're going to, as the resource team, going to provide all of the colleges participating with some guidance and supports to the members of the community of practice. We're going to build on the collective knowledge of the group to kind of move this forward. And again, as we've discussed, these shared networking and opportunities for that. And we also really want to provide the most efficient method of producing change, because we all recognize that you guys have a million other things to do in addition to this. It's not like, everybody can stop everything they're doing and just focus on this one project. So we want to do this in the most efficient way possible. And also very, very clearly, and I'm going to keep saying this over and over again, be particularly focused on the unique issues that are raised by each participating college. Okay. So one of the structures, and what we're going to ask each of your colleges to do if you choose to participate in this, is to identify what we call a core implementation team. And the core implementation team is made up of 3 to 4 individuals who are going to be responsible for implementing and participating deeply in this project. They will then go back and work with many, many other members at the college, but the goal is to have a team that's responsible for actually taking leadership over the project and implementing this project as they move forward. And the membership of the core implementation team is going to vary a little bit depending on how each college is set up and structured and how each program is set up and structured. But usually, they involve folks who are in program administration. So the director of the program is usually the head of this implementation team. It's great to have somebody, a faculty member, who's actually doing teaching, and sometimes those are the same people and sometimes they're not. Somebody who's in charge of supervising, involved in supervision, sometimes, and also if there's somebody who's involved in managing data and those kinds of things, involving them in the program. But what I'm saying is other than the program director, the real idea is each of your teams will vary a little bit in terms of their structure.
Yeah, let me just add the piece to, why are you guys doing this, right? Why are we suggesting developing such a team? For those of you who may have seen the organizational literature over the last 30, 40 years, across all systems, when it comes to planning a change in any organization, what the finding is that having the right people as a right team, really being sort of taking the core responsibility, and then developing those strategies, learning about what are some of the options, and then developing plans and implementing those plans, and then evaluating whether or not the action steps have really worked out, making changes based upon that is a consistent finding just across all systems that are interested in introducing innovations or changing processes or changing practices and improving quality. So we just didn't make it up. It's something we've also experienced with having probably collectively among us here at NYU, we probably run 25 communities of practice over the last 10, 12 years. And that finding is really important. The strength of that team is directly related to the accomplishments of that team. So we just want to really emphasize that part of it. Andy?
Thanks so much. So I think one of the things is, what are the concrete things that we expect to participate in the community of practice? So one, the team is going to meet regularly. And what we have found in doing these, a number of times is it's somewhere in the 2 times a month is really the minimum to meet to really make something happen. And what we found is that, teams that meet once every month, once every other month, that the kind of, you lose that momentum to actually be able to get things done. So meeting regularly 2 times a month doesn't mean you need to have 4-hour meetings 2 times a month, but checking in 2 times a month on your progress. Making a commitment to engage in all the community practice activities, which we'll go into depth in a minute. Engaging the leadership of your college and of these programs in making sure that they understand and support these activities, right? And one of the things that we'll talk about in some of our opportunities is some suggestions for how to actually engage leadership in this process, right? How to actually, and I know we met with a focus group of folks, it was one of the things we talked about a lot, is how do you actually engage your leadership in this process? And then we're going to expect people, and we're hope people are going to select practical and meaningful improvement goals that are aligned with the principles of trauma-informed care, but more particularly aligned with what are the unique circumstances of your college. And I think that's really critically important. I've said it 4 times, but it's really critically important to make sure that whatever you're going to do is going to be impactful, but impactful within the particular context that your particular college is working. You're going to share ideas and strategies and resources with the other community of practice members. The hope is to improve the whole, and a lot of that is based on learning across colleges. And then proceed at a pace that's practical for you and your college. So there will be some colleges that are able to do huge amounts, and some colleges that take 1 or 2 practical steps forward. And that actually is really critically important to view this within the context of what you're doing. And for those colleges who make huge progress forward and those who make 1 or 2 steps, those are both equally meaningful to the college that's doing that. And then the other piece, and we'll talk about this with a decision guide, is honestly assess your capacity and your capability of doing this, right? To make sure that you have the capacity to truly participate and kind of meet these goals. And then what's our job? What's the role of the NYU research team? So our job is to provide the technical expertise, the clinical expertise, and all of the organizational expertise, and then all of the logistical support to all of the members of this. So our job with this is to make this as seamless and smooth as possible. We're going to provide, information about the principles and practice of trauma-informed care. We're going to organize full day kickoff meetings across 4 different sites in California to make this as easy as possible for everybody to get to. We're in New York, which is a big state, and as a California I grew up in California. I also recognize California is a big state. So we're going to spread this out geographically in such a way that it won't hopefully be too burdensome for people to get to. We're also going to organize individual and group consultation calls with people to be able to help identify their needs, facilitate access to resources and tools, and provide support for them. And then we're going to, facilitate the meetings associated with the project. Okay. All right, so we're going to put up a poll question here. And the poll question is, how likely are you to be able to meet the expectations of the community of practice? So based on what I've outlined so far in terms of having a full day meeting, some webinars, and then monthly check-in calls, how likely is your organization to be able to meet those needs or meet those expectations? Yeah, so take a minute and answer the questions, and then it's going to go for another 30 seconds or so, and then we'll get the results. So, the goal really is to identify, how likely you are to be able to meet these expectations. All right, so the poll is closing now, so we should get the results just momentarily. There's always a bad joke in here about Jeopardy music, and if I could sing, maybe I would play
that
Jeopardy
actually
music
would
in
be
the background.
good, and if we had some Jeopardy music
we
in
really
the
need to do
background.
that. Yeah.
Okay.
Yeah, but you don't want me singing.
No.
You can sing. I cannot.
No. Do we have to have a poll question about that?
Well, if we had a poll question about whether or not I should sing, we might break things.
Okay.
So I think the good thing is most people who answered said they were either likely or very likely to be able to meet the expectations of the project, so that's good. There were a couple people who were not sure about that, which is understandable, and I think part of this process is kind of moving through this and figuring out how it fits in your organization as well. Okay. So Tony's going to take a second and walk through
really very brief about this. As part of this notion of a continuous quality improvement, one of the things that's important is to kind of know where your starting point is. So we really developed this organizational decision guide so that it's a tool that the improvement team, right, the core implementation team, may use to ensure that, one, that they have an understanding of what are the different components of trauma-informed care and resiliency-focused educational approaches within a prison context. So that's like one of the first tasks to ensure that the team has a shared understanding. And then it provides the college with an assessment of their current alignment, right, with those various components of trauma-informed care. We don't start out with the notion that everyone is at like ground zero and that people are at different places with different components of trauma-informed care. And it helps them to identify, well, we're already doing some things that are aligned with trauma-informed care. There are some areas where we can make some improvements. It also helps us to decide on where do we want to begin. What would be our first starting point? So we created this guide, and I'll tell you just a little bit more about it. You'll hear more about this as we go forward. So there seem to be three major components that we've heard from in our current meetings, our past meetings with some of the faculty and staff visiting a prison, a male prison and a female prison, and we've tried to compile what were some of the common issues that came up. So one area, of course, is just ensuring that there's a foundational knowledge and set of skills for faculty and staff, that they have an understanding and ability to address the impact of trauma resilience on students' academic performance. Another major area is workforce wellness, success, and satisfaction. And those are the issues that I had already raised around burnout or compassion fatigue or vicarious trauma. And the other is trauma-informed and resiliency supporting educational practices. A lot of that has to do with how best to communicate with students, how to address various issues and experiences I have with students when they raise this or they share this in one of their assignments, or they're talking to me about a certain thing, or they're referring to me in a certain way. Those very, very basic kinds of responses to ensure that your educational approaches really are designed to align with some of the strengths that students bring, but also an understanding of some of the challenges based on adversity in a student's life. So we'll provide you with sort of guidance. This is going to be one of the first tasks, is to develop a focus for your work. So we want to get, again, just some feedback from you. You know, right now you're getting a lot of information, but based on what you've already heard, when you think about the focus of all of this, how important do you think this project is to you? And just let us know whether you think it's from everywhere from very important to mostly not that really important. So let's see, we give you a moment. We have a few seconds, Andy.
We have a few seconds.
I can't see.
They get a whole minute to fill it out.
Okay. Oh, all right. All right. Very good. So we'll just give you some time to think that through. And we'd like to hear from everybody who's on the line here.
Okay, so the poll is going to wrap up in just 5 more seconds. So if you haven't answered the question, answer it right now. All right, the poll has wrapped up, and we should get the results in just a moment. I need multiple jokes if we're going to have multiple polls in the thing, because I've already used the Jeopardy joke, so
Okay.
we need another.
All right, so just a moment, we should have the results. This will give us an understanding of how relevant you think this is to you.
Okay. So very good. The vast majority of people said that they find it to be either very important or important to their work.
Well, that's good. It sounds like people don't think it's unimportant, and they're not sure about it. So that's positive. And so we're glad that this is aligning with what you guys see as an important part of your work.
Okay. So I'm going to walk through logistically how you choose to participate in this project.
Right.
So we're going to send out an application, and Kelly, you can jump in if I get this wrong, but we're going to send out an application immediately after or very close to the end of the day today. It is very simple. It's your name, your college, who are going to be the members of the team, and we're going to ask you for some direct feedback about what's most important to you associated with the project, and we're going to ask you which of the 4 in-person events your college would attend, because even though we can kind of break that down geographically, you never know. Maybe the folks in Northern California want to go to San Diego or vice versa. So we're going to do that. We're going to send that out at the end of the webinar today, and the email will probably come from Kelly, so you'll get this email. It's going to be in a Qualtrics system, which is very similar to SurveyMonkey, so it'll all be online. There's no mailing or faxing or even emailing back and forth. So we're going to get all that out today. And then you're going to have till the 19th to complete that. And there will be some, appropriate, I like to say appropriate pestering involved. Well, there'll be a number of emails sent out, I'm sure, to get people to fill it in and turn it in. And you can reach out to us, and we'll be glad to answer any questions that you have. But we don't anticipate that the actual application will take more than, 10 minutes to fill out.
Yeah, I think it's more really an expression of your interest and desire, and that you feel at this point you can make an informed decision that this is something that you can engage in a way that's likely to be successful and won't overburden your own, capability or capacity at this point.
Fantastic. All right, so I'm going to take just 30 seconds really quickly and walk through the timeline, and then we've gotten a number of questions into the chat box, so we're going to have some time at the end to answer those questions. So if you have other questions, feel free to start chatting them in now, and we'll get through as many as we can. So in November, today is the first bullet point. We're having this launching webinar for Sustaining Futures Project. The application will go out today after the webinar, and it'll be due on the 19th at 5 p.m. Pacific Standard Time, not Eastern Time where we are. And then on the 27th, after Thanksgiving, we're going to announce and all the participants in the project. And then on the 30th, we're going to have our first formal web-based project, web-based training on the project, which is going to focus in more depth on trauma and resilience. We gave, the absolute minimum possible today so we could squeeze all this into an hour, but we're going to go into more depth on a webinar on the 30th, really talking about the impact of trauma and resilience as well. And then on the 25th of January, we're going to do another webinar on the organizational decision guide and event prep for the in-person meetings, because what we want to do is we want to make sure that those meetings and those days you choose to spend with us are as focused on action as possible, and we don't spend a bunch of time doing logistics. So we're going to try to do that online prior to the meetings on the 25th. And then in February, we're going to have 4 events. We're going to have one on the 1st in the LA region, hosted by Chaffey College. We're going to have one event in the Central Valley region, hosted by Bakersfield College. And then for the agencies, for the colleges that attend the first 2 events in February, we're going to start consultation calls with them in March. And then we're going to have another event on March 1st in the Sacramento region. And then our final event will be in the San Diego region, hosted by Southwestern College on the 15th. And then those colleges that participate in the March events will start their consultation calls in April. Okay. And then between April and September, we're going to have a blend of individual and group consultation calls with a member of the McSilver team or multiple members of the McSilver team to kind of talk about progress, overcome challenges, provide advice, do all those kinds of things. We'll probably have a number of other web-based trainings based on individual needs. So when we start hearing from more than one team that they're struggling with a particular issue, that's an invitation for us to do a training on it. We'll do that. And then we will build to, from September to October, a convening on the 14th and 15th of November in Sacramento, where every team will have the opportunity to share their results and share their progress. It will also be an opportunity to bring all of the teams together to really think about this, and this is going to be in the context of a broader meeting that the Opportunity Institute is going to be having, and we anticipate that there'll be members of the Chancellor's office and all sorts of other folks there as well. So it'll be a really good opportunity for folks as well. Okay, so based on this webinar, how interested are you in joining this project? So we are, we've tried to provide as much information as we could in a very limited amount of time, but based on what we've provided today, kind of how interested would you be in joining this project?
Has this really piqued your interest? Everywhere from very much so to not so much. Yeah. Give you some time to respond.
Have 5 seconds left. So if you haven't, although it looks like our poll question froze, but so the poll question should be wrapping up, and then we'll get the results shortly.
And then we'll respond to questions or share comments that folks may have typed into the chat box.
There we go. So based on this, we have the vast majority of participants say that they are very interested in joining the project. We have a couple of folks who said they're not sure, and one agency that this might not be for them, which is also fine as well. So thank you everybody for participating. But we seem like we've hit about the right spot in terms of most people being interested.
Terrific. Thanks so much for sharing feedback on that.
Absolutely. Okay, so we are going to take a brief moment here to read through the chat box as we get to questions. And then we'll start identifying some of the questions that have come up. So the first question that we had come in which was, should this team be only college employees, or can it include the prison principal or college coordinator? So I actually think that's a really, really good question. And this is where I want to get back to kind of the uniqueness of each college, right? And so while my initial response is, well, it should probably be college employees, I actually think depending on the situation that you have in your particular context, having the prison principal or somebody else in a similar role be part of the team would be excellent. If you can get them engaged in the project, that's fantastic. Because really what you're trying to do is, to the extent possible, have kind of the collective wisdom associated with this. And if you can engage others outside the college in that, that's great. But for some of you, that might actually be counterproductive, where having that person involved might actually derail the project. So I think that the key is this depends on your particular college context, but it's an excellent, excellent question. And I would just highlight, just more broadly, that this is the kind of thing that you should be thinking about as you go about pulling together your team, right? Who are the real keys to having on board as part of this project? All right.
So we did have a number of comments of really zeroing in on some of the unique challenges and stressors that are associated with prison life, everywhere from the environmental factors like fences and classrooms not conducive to good instruction, some of the interpersonal issues that take place in a prison, the hostility from custody, even issues around sexual comments from incarcerated men towards women faculty, et cetera. So some of these issues, which really contrast with some of the experiences perhaps in like sort of psychiatric sorts of setting, because they're very different. And others were just commenting on how important that is to look at the environment of the prison, the notion of the faculty, custody, and students, that this kind of triangulated situation can be particularly challenging, the frustration and anger with custody. And so there's both emotional reactions to this that can sometimes not be all that healthy, especially if people don't feel that they have really are in a situation where they can change any of those things. And it can have like an impact whenever you're in a situation where it's sort of like a learned helplessness kind of environment where you're not in as much control over the changes that you can make. So one question, should the team be only college employees? That came in and Andy responded to that. And let's see what else we have. Carol mentioned she serves Northern California, serving CSP Solano in California Medical Facility. Would be happy to be part of this team. And she's also working on her dissertation.
Fantastic. And so that's fantastic. And hopefully she can be part of the Solano team, because that would be amazing. And anytime you get a PsyD, having one myself, I'm always a big fan of that. So.
Okay. Others are just saying that they're finding this helpful, that they're interested in joining the project. Some had some problems around the polls. And then also, if the program is very small and only 2 faculty teaching, that's why we commented that each college is and setting is going to have, some variation in who the members in the CIT.
Right.
We just want to say that optimally, having 3 or 4 people tends to be sort of an optimal number, but you guys have whatever reality you have, and if it's just 2. Then we wouldn't want to disqualify you, based on that. But then it's a little bit more of a challenge, of course. There's some positive things in terms of being able to meet, but there's the downside if someone is not around, then you're really working on your own. So if you can engage others so that you're up to 3 or 4 members of the team or more, that would be optimal. But again, we're not here to set sort of boundaries and restrictions that an interested set of individuals or get disqualified. We're not approaching it that way. If that's what you can do, God bless, and we're more than happy to work with you.
Yeah, absolutely. So we've kind of reached the end of the questions that have come in so far. So if anybody else has any additional questions, feel free to chat them in, and we will answer them. So we'll give folks a minute or so to kind of chat in any additional questions.
Well, Andy, what if people, as they're filling out the application, or they talk to some other folks, and they have some questions, how would they be able to get those questions answered as they begin to think about joining this? Oh,
that's an excellent question,
What a segue. What a segue.
So you can actually reach out to Kelly at the Opportunity Institute, and I'm sure pretty much everyone has her email and phone number here, but you can reach out to Kelly, and if it's a question particularly geared towards us, she'll connect us, or she'll answer it on her own. And then the question here is, are there stipends for faculty to be part of the CIT? And Kelly, I'm going to kick that one to you if you don't mind.
Sure. Hi, everyone. Yeah, we are paying flex time. Someone asked if there are stipends for faculty, and we are paying flex time stipends for the faculty who are participating. So you can reach out to me directly, and we'll sort of coordinate that process.
Fantastic. So good to hear. So that's actually a really important thing, that there will be stipends available for folks. Another question was, can they get a copy of the webinar? Absolutely. We've recorded this webinar today, and we are going to make the recording available, and I believe it's going to go up on the Opportunity Institute website, and it'll be available to folks. And we can also make sure that we send out a link to everybody once it's available. The reason we record all these things is we recognize that everybody is not able to always show up for something at a particular time and place. So one other important thing to highlight, which we didn't talk about over the course of the webinar, if anybody else has any questions, now is the time to chat them in, is that at the end of this, each college and also more broadly will get a toolkit that has all of the tools and all of the training and all of the information throughout the project involved for themselves, and it'll also be available through the Opportunity Institute. So there'll be a toolkit of this. And every training we do, we will, especially all the online trainings, not the in-person trainings, but all the online trainings we do will be recorded and available to everyone as well, because we do recognize that not everybody can always come at a particular time and place.
Let me just sort of, I know we just have maybe, what is it, a minute or two, Andy?
Yes. We have
okay. Let me just share this with all of you. You know, here at McSilver, one of the most important areas for us is to really do something about the sort of poverty to prison pipeline. And right now we're just sort of talking about it, trying to figure out ways, but you guys are part of it. You guys play an incredible role in trying to disrupt that, poverty to prison pipeline. Once they get at the end of that pipeline, how to ensure that people don't get necessarily stuck in that and they have greater opportunities. And we've come to our understanding of the degree to which, poverty is such a contributing factor to the adversity in people's lives. And so for us, we're very excited to partner with you in being able to just begin to learn about how we can do this better, how we can create both systems and educational programs in prisons that are likely to lead to success, but also, as important, that it's feeling successful to the faculty who are really on the front lines, and the staff and the program coordinators and all who are involved, so that they can be successful in turning around the lives of folks who have ended up in incarcerated settings. So we're just really very excited to be part of this. We're pleased that you're expressing some interest in this area, and it's also a dynamic process. We start out in a certain way, but you will be also helping us to create what follows based upon the lessons you've learned, the areas that you and your expertise in working in the settings that you work with and with the population you work with. So I just wanted to kind of say that, and I think that's an important thing.
Yeah, absolutely. So we haven't gotten any further questions, so I think we'll wrap up here. But I just want to follow up on what Tony says, and we're really, really excited to be working on this project with the Opportunity Institute, and looking forward to working with all of you. So you'll be getting an email today with the link to the application. Please fill it out. You've got a couple weeks to do that. Again, it shouldn't take more than 10 minutes to fill it out. But probably the biggest part is figuring out who's going to be on your team. Right. So fill it out, figure out who's going to be on your team, and send it back in. And we look forward to working with everybody in the next month or so. All right. Take care, everybody.
Bye-bye, everyone.